Guys, I'm going to be discussing EMDR and what it entails and so on and so forth. Okay, EMDR, it is eye movement desensitization and reprocessing. So what is EMDR? EMDR is an organized therapy which focuses on trauma treatment, the trauma memory treatment, while at the same time going through bilateral stimulation, which is generally eye movement, but there are other symptoms or sensations that go on with it as well too, which is associated with limiting vividness and emotional connection within these memories. EMDR entails that there's 8 phases into the session, and it can go with multiple phases into one session. Primarily, the phases 1 and 2 are more in the earlier sessions, and phases 3 to 8 can go on the later sessions. So the complexity of the trauma, it has a direct impact. It depends on the number of sessions. Per se, like a single disturbing event usually takes between 3 to 6 sessions to see results. But if it's longer and the trauma is a little bit more complicated, it takes 8 to 12 sessions, if not more. And these sessions usually last from an hour to 90 minutes. EMDR has 8 phases, as I said. So first phase is just pretty much information taking, gathering patient history, and like seeing what's going on from from childhood or when that memory that started, triggering the PTSD until onwards. Second thing is just pretty much like phase is to benefit the patient and the physician to educate them on how this situation works and how the patient will react to it. Pretty much it's given an expectation on how like the patients will know what to expect and make sure that they're safe. So assessment is the third phase. So pretty much this will be discussing on like what the goal is into this treatment, but it also will help you identify like the negative and the positive like beliefs of how your trauma has impacted you and how you're going to move yourself forward. Step 4 is desensitization and reprocessing. Pretty much with this, it activates your memory and helps you identify more specific images, feelings, thoughts, and like body sensations. So pretty much this is kind of like the heart core of the EMDR process, just because this is gonna try to like help you reprocess your thoughts and feelings throughout the session, and new discoveries are gonna be made. So step 5 is pretty much like installation of like how you're gonna reprocess this memory into a positive thing rather than having it into a negative thing. So around steps 3 and 4 is like how you're gonna be what the therapist has learned and what you have learned hand in hand on like how this can be, used into later phases. So phase 6 is the body scan. So pretty much this is more on the physical side. So it's gonna target like how you are doing overall, like how your body's like going through like the memories, so on and so forth. And this how can these symptoms will gradually increase, and hopefully it does continue to decrease. And the reprocessing state is complete. And phase 7 is the closure within these like sessions. It's a bridge from the earlier to the later sessions. And pretty much this is like more of an expectation on like how you're going to be moving forward in the future and what are the necessary things that need to be done. And then step 8, final step phase, you're pretty much being reevaluated and how to continue with this therapy, whether you're recovered or not, and seeing like what you have gained knowledge within the EMDR and how you're going to be processing the trauma itself and if it is processed. So those type of questions and seeing how you're currently doing. Okay. Hi, my name is Elizabeth. I am actually a person that has recently decided to go through the EMDR process. Reason why is pretty much I just have a lot of like childhood trauma, um, and coming to the point where it's holding me back. I'm stuck in my memories, and in a way I can't go forward just because there's just so many things that trigger me and the constant anxieties there. So I actually have like started the process, and it's going. So yeah. Okay, insider tips. So pretty much what is EMDR? What does EMDR help with? Depression, anxiety, PTSD, trauma. And then the bilateral stimulation, that's more on like eye movement, but it's also like within tapping your knees, or back and forth sounds that can be used, which your therapist will safely guide you into the process. So obviously, like I said, memories are reprocessed, and your therapist will help you like resolve like how the stress and the symptoms are pretty much associated with this event as well. And um like mentioned, for me, myself personally, I pretty much felt stuck into my memories that are constantly affecting me just because I'm constantly having to have anxiety, and it's just taking a toll. So pretty much more progress, less time, just depending on like how your body is reacting to these and how, having to talk about it. Okay, let's see. Okay, so what are the how is the studies of PTSD affecting? So there are studies that have a positive outcome. Some studies show that it's an 84 to 90% positive effect, which in a single event, there's no longer like symptoms of PTSD. Other studies show 100% rate of like trauma victims. And lastly, study shows that 77% have multiple trauma victims after 650 minute sessions. So, I mean, as you can see, good results. But then I also will like put in the article that I did find this in as well. Can the effectiveness place the placebo attributed to the PTSD? So study shows that it is beneficial compared to having no treatment or the placebo treatment. EMDR has performed actively, like with listening standard forms of trauma care, including individual therapy, psychodynamic behavior therapy, and relaxation within biofeedback. Okay, what organizations recognize this? So the American Psychiatric Association, World Health Association, Department of Defense, and the U.S. Veterans Affairs and Department of Defense placed into Category A, which effective PTSD psychotherapies. And I guess like random fact that it also is a effective treatment within the United Kingdom of their Department of Health. So yeah, it's efficient. So with the brain, whoops, whoopsie, hold on. With the brain on like how it is like if like EMDR can help. So the amygdala increases. So it's pretty much having to like make yourself aware on like which emotions are real in terms of like how it is reprocessed within the memory. Not saying it's not real, but just how it's reprocessed and into a positive light instead of having to have that fight, flight, and freeze mode. And then the hippocampus pretty much does assist with the memory storage and how it is reprocessed into our minds or the people that have the trauma. Um, lastly, the prefrontal cortex, sorry, does shrink because it does manage throughout the behavior and thoughts. and to control our emotional response within situations. So they all come hand in hand. So pretty much like it decreases like the stress levels, but yet it also increases the emotional levels. So all my references are in the next slide. And pretty much I hope you guys enjoy my discussion about EMDR. And yeah, I hope you guys learned from it. Have a good day.